right?
Yes.
Yeah.
I just want to make sure there were no changes. Okay, so from my office, we have Raven Vinson, who will be making our presentation.
Okay, good afternoon, everyone. The operating budget highlights for the Department of Economic and Workforce Development begin on page 2. As shown in the budget summary, at the top of page 2, the proposed FY26 operating budget for the department totals $77.8 million, a decrease of $15.1 million, or 16.2% from the fiscal year 25 budget. The general fund portion of the budget totals $2.7 million and increases by $219,000 or 8.9% over the fiscal year 25 budget, primarily due to increases resulting from the transfer of 2 additional positions to the department to support local economic initiatives and engagement efforts within assigned council districts. While the special fund portion of the budget totals $75.1 million and decreases by $15.3 million, or 16.9% from the fiscal year 25 budget due to changes in anticipated grant funding. Other noteworthy highlights on page 3 include decreased turnover savings from 3.6% to 1.8%, noteworthy changes to the special fund, including new grants, the Economic Development Revolving Financing Fund, EDRFF program, and the county's tourism program, as well as organization contributions, general grant program, and operating grants to arts and culture organizations. Capital budget and ARPA highlights are mentioned on page 4. Also on page 4, Exhibit 1 displays the department's budget history, while on page 5, the pie charts, Exhibit 2A and 2B, show how the proposed funding will be allocated by type of program and type of expenditure. Economic development grant programs represent the largest slice, and workforce development grant programs are the next largest slice. Continuing on page 5, Exhibit 3A shows the general fund budgeted increases and decreases, with personnel cost changes in blue and non-personnel cost changes in orange. Exhibit 3B, immediately below on page 6, shows the special fund budgeted increases and decreases by grant program. Exhibit 4, at the bottom of the page, shows a history of authorized versus filled positions. For fiscal year 2026, the tourism program increases by $297,000 to $2.3 million. On page 7, Exhibit 5 shows the tourism program grant budget, reflecting the increase of $199,000 to provide grants to 25 organizations. On page 8 and 9, Exhibits 6 and 7 present the county's organization contributions grant programs. Organization contributions total $7.0 million and include $4 million for the general grant program, Program 5902, a $53,000 increase, and $3 million for the operating grants to arts and culture organizations, Program 5901, a decrease of $2,000. On page 10, Exhibit 8 displays fiscal year 25 to fiscal year 26 comparison of the department's Economic Development Financing Fund. Continuing on page 11, the analysis notes areas within the budget that may reflect department-specific budget flexibility in an effort to provide insight into the operational context for any potential reductions. Finally, we have prepared a list of questions for the department and the Office of Budget and Finance, which we are hoping can be discussed today or addressed in a written response. I would like to thank the department and OBF for their assistance during this budget review process. And at this time, I'm happy to turn it over for discussion.
Any discussion at this point? Jonathan, you want to?
Yeah, I'd be happy to kind of share some of our highlights and the work that we're on. So good afternoon, Mr. Chairman and members of the council. As you know, I'm Jonathan Sachs. I'm the Director of Economic and Workforce Development for Baltimore County. When I began in this role almost a year ago today, one of my first goals was to fill vacancies in order to strengthen the work of the department and in turn bring a sense of stability to the divisions within the agency. Almost 365 days later to the day, I'm proud to say that we have not only filled those vacancies, but more specifically, we have filled critical roles, inclusive of our talented senior team, who most of you met last month at the council hearing. Once fully staffed, our senior team met and embarked on a journey to set the department's groundwork and see what connects each of the divisions within the department. We discussed our role to support employers, workers, and the part we need to play to establish placemaking in the county. Keeping in mind each of these roles, we established the foundation and a mission statement for our department. The Baltimore County Department of Economic and Workforce Development advances and fosters economic activity in order to grow the tax base in Baltimore County. With this new mission statement in mind, I'm proud to share a few notable initiatives within the department that we've established to advance economic activity and in turn achieve our goal of growing the tax base. To meet the needs of Baltimore County businesses, we launched GROW, an incentive-based program that provides funding for businesses signing their first commercial lease in Baltimore County in an effort to offset their business expenses and attract them into our county. Using our existing resources, we were also able to launch our second initiative, the creation of the Division of Data and Economic Analysis. This division enables our department to not only be more data-driven in our decision-making, but allows us to better track economic activity happening across the county in real time. Lastly, we are working to reconstitute our Economic Development Advisory Board. We are confident that the restructuring and reconstituting of this board will be critical to charting our path and strategy forward in tandem with leaders in the business community here in Baltimore County. While we are sure these initiatives will help us gain momentum, the work continues in all areas of our department. I'm proud to share some of the positive economic activity that has occurred across the county in the past year. On the west side of the county, RWD Construction acquired a 51,448 square foot warehouse in Owings Mills for $7.75 million. The firm employs more than 300 workers in 9 U.S. offices and relocated their regional headquarters to the county in October 2024. We have also continued our commitment to the Pikesville Armory. The foundation broke ground in January 2024, unveiling plans for a $100 million renovation and preservation of the 14-acre historic site. The first phase of redevelopment began in April 2024 and will continue to work with their team to ensure this project sees success, and we know it will be an economic and quality of life driver in the county. In the northern part of the county, we have continued to expand our work with the county's first Office of Agriculture. The office is providing on-site services at the Ag Center to the agriculture community. We have also had 2 new acceptances of job offers for the remaining agriculture positions, the Agriculture Business Development Specialist and Agriculture Fellow, meaning for the first time, the Office of Agriculture is fully staffed. In the central part of the county, American Robotics funded a world-class autonomy innovation and technical training center of excellence in Sparks that launched in 2024, focused on solutions needed by the defense, government, and commercial sectors. Hunt Valley Exchange, the 17-acre parcel purchased by St. John Properties, is expected to deliver 113,000 square foot of flex R&D and retail space in 2026. Green Bay Packaging continues to update their state-of-the-art facility and equipment. They currently employ 140 employees at this location and are actively hiring. In the eastern part of the county, we have worked with Sumatech to complete a 75,000 square foot facility in White Marsh. Rocket Labs Neutron was approved to compete under Space Force's NSSL program. The site was selected by the U.S. Space Force to compete for the Department of Defense highest priority national security missions. The contract is a 5-year ordering period that would run through to June 2029 with a maximum value of $5.6 billion. We have also reestablished our commitment to economic development in the area by redesignating the Chesapeake Enterprise Zone. This zone is now secured through 2034, ensuring rapid growth and supporting ongoing development. This redesignation is critical for so many of our partners, like TradePoint Atlantic. These income tax credits as part of the Enterprise Zone have supported an addition of nearly 12,000 new jobs at TPA in less than 10 years. Speaking of TradePoint Atlantic, we've continued our work for the Terminal Investment Limited Partnership, which is a 330-acre redevelopment project. We expect this will support 8,000 jobs and add $1.5 billion to Maryland's GDP. Thinking about one of the other sides of our department, last year, when Senior Deputy Administrative Officer Samir Sid sat in the seat, I know he discussed some of the challenges our workforce development team faces regarding our WIOA funding and the limitations it places on eligibility and program requirements. We were grateful to receive $1 million to create an innovative job accelerator program. These dollars provided an opportunity for us to invest in workforce training without the strict eligibility requirements that I mentioned when we were together last month. We are proud to share that we have put these dollars to good use. Not only do we utilize our innovative workforce funds to create meaningful opportunities, we were also able to leverage and braid KeyBridge recovery funds to expand our net of participants. Within the last year, we have established partnerships and training programs with North American Trade Schools for CDLA and diesel mechanics, Earl Beck and CCBC for welding. To date, 6 participants have started and successfully completed the welding program. 8 have started the CDLA program. 3 people are slated to start the diesel mechanic program. 9 participants will soon start diesel tech and CDLA licensing, and 9 are slated to start their CDLA. We are also currently in the initial finalization of plans with LifeBridge Health and Northwest Hospital to develop a CNA training program. We are certain these programs will enhance employer growth and engagement, expand investment in workforce training, and create sustainable job opportunities for Baltimore County residents. For economic development, our general fund increase of $204,759 is driven by the transfer of 2 specialist manager positions into our department. These positions will serve as business development liaisons, roles that will be critical to our department's mission to grow the tax base in Baltimore County. These positions will join the business development team and be assigned to a councilmanic district to support local economic initiatives and engagement efforts. Workforce development's budget reflects an increase of $14,275, which will be allocated towards operating costs associated with the 3 American Job Centers. For our KeyBridge recovery efforts, we received funding to help with those initiatives and remains a critical component of our budget, with a detailed financial plan in place to carry through to February 2026. Investments under this funding will support workforce programs and stabilization efforts tied to the collapse of the KeyBridge. In FY 2025, outreach was conducted to over 400 employers and businesses to offer reimbursement for hiring temporary employees for cleanup efforts. The department has also fully obligated all $9.1 million in special ARPA funding. These funds provided essential short-term relief for workforce development initiatives, ensuring community stability while bridging gaps in state funding. The federal deadline to obligate ARPA funds was December 31st, 2024, and the deadline to complete spending is December 31st, 2026. The department confirmed that all funds were obligated by the 2024 deadline and remains on track to fully expend the funds by 2026. The county's loan programs continue to support business expansion with a strong focus on assisting small and startup businesses. The county will continue providing its 10% match to state-led economic development projects. One of the critical hires I mentioned earlier was an arts and sciences grant manager. Since her onboarding, I am proud to share that the department has maintained an annual application process open to arts, cultural, and science organizations. Where appropriate, funding allocations are strategically adjusted to assure organizations receiving support are effectively benefiting county residents and advancing economic development efforts. The department continues planning and participating in job fairs to assist dislocated federal workers and connect them with local employers. The Career Center's increase will directly support client services, expanding training opportunities for WIOA eligible individuals. The department has also received funding from the Office of Statewide Broadband Maryland Computer Labs to improve digital accessibility at the Baltimore County Career Centers, equipping computers with assistive technology for individuals with disabilities. In tourism, the rebrand and marketing initiatives have already proven effective at delivering measurable economic returns for Baltimore County. To support the rebrand, we invested in building a robust library of owned photography and video assets, showcasing year-round activities and destinations across the county. These assets not only positioned us to launch the first ever dedicated marketing campaign for the county, but also follow-up campaigns. Our inaugural spring-summer FY24 campaign focused on brand awareness and strategically promoted multi-night stays to boost hotel tax revenue. The results demonstrated clear fiscal impact. Almost $703,000 in new attributable revenue from key driving markets was realized. Building on the momentum, our targeted FY25 campaign delivered another $924,000 in attributable revenue. In fiscal year 2026, we will advance from foundational growth to sustainable impact. We will continue our work and supporting the events that are coming to the county. For example, the BMW Championship, the Hunt Cup in Chewan Downs, and the Maryland State Fair. With a focus on sustained growth, data-backed strategies, and high-profile event support, our FY26 plan is designed to further enhance tourism-driven tax revenue while responsibly managing the county's reputation as an accessible destination. Just a reminder, as I close out just my comments on the budget, I wanted to just read our mission statement one more time. The Baltimore County Department of Economic and Workforce Development advances and fosters economic activity in order to grow the tax base in Baltimore County. As I shared when we were together last month, when I came before you about a year ago through the confirmation process, I really spoke about three things: stabilizing the department's performance, aiding with the Key Bridge economic recovery, and then participating in regional collaboration. I feel like we've made really good progress in all three of these areas, all with the goal in mind of building the tax base here in our county. And with that, I just wanted to share a thank you and see if you had any questions for me that I could answer.
Any questions from the members?
Yes, Mr. Chairman.
Yes, Councilman Mark.
Yes, hi. Thank you very much, Mr. Sachs. I think you're doing a really good job, and I appreciate the progress you're making on those initiatives. Your office is participating in the discussions regarding the reforms to the permit process, correct?
Yes, we have some involvement there.
Okay. Definitely more of an issue for our permits folks, but I mean, I think I could speak for my colleagues. That is probably the number one of the biggest frustrations we deal with is just the status of permits. It is a major disincentive for people who want to come into this county. Just the tremendous amount of time it takes to get a permit. The fact that there doesn't seem to be any concurrent review of projects, everything's sequential. So appreciate your input there. And then secondly, I've asked you before about the 250th anniversary celebration. What's the status of that?
Yeah, as I mentioned last month, we're working closely with our with the state group that's leading that effort. And we have several events planned for 2026 and are working to make it really spectacular and to highlight a bunch of different assets in the county. So, we met last year. I knew that was a high priority. And as I've learned about it, it's also become a high priority for me. So I've been excited to hear the work the state's doing and our opportunity to really partner with them to make sure the celebration is really fitting and exceptional here in Baltimore County.
Okay, very good. Thank you. Just again, please work on that permit process. It is, in my opinion, the number one disincentive for people to invest in this county right now. So thank you.
And Jonathan, I would add to what Councilman Mark said. I was eating in a Mexican restaurant yesterday in Rosedale. The owner is trying to open another restaurant in Perry Hall, and he basically said to me, I told him we were talking, and I said I was the councilman for the area, and he did this to me. He put his hand up to his chin and said, kind of up to here. He goes, I can't get permits for this Perry Hall location. I'm running out of money. If I don't get something soon, we're just not going to open the second location. We had another situation where a restaurant went out of business in Rogers Forge, and this is after the fact that they were in business, but they had a lot of trouble with permits. They ended up taking a lot of time, and he attributed some of the business failure to the point that he couldn't get permits, but yet had to pay rent, and he owed back rent to the owner, even though it took him 7 months to open the business. But we hear it constantly, and the administration just doesn't seem to be moving quick enough on it. I know we're looking at new software, but I hear that's going to be held up another several months because of whatever. But we are having this hearing on the 14th, and if you can be there, it would probably be good to hear. There's going to be engineers there, business owners, you name it. So there's a lot of frustration out there, and we've heard it for a long time, but it just doesn't seem to be getting better. So anyway, sorry to be a downer. Councilman Young.
Thank you, Mr. Chairman. So Director Stacks, appreciate the presentation. Couple questions, just wanted to get clarification from you. Special funds decrease, which isn't a surprise from our conversations leading up to now. I guess I wanted to try and marry up the fact that there are 14 vacancies and 11 of which were special funded. And just wanted to kind of get your, one, they were positions funded by special funds. It's not a surprise that we had a decrease there. Long term, though, are these positions that are going to be phased out, or are these ones that are going to be held on because we're expecting to possibly have those special funds brought back up to then fill those positions? So just trying to marry up what I'm seeing on the analysis versus what the presentation is, because you were increased from 81 or 88 positions to 91, but those aren't special fund positions.
Yeah, our goal is to gradually phase them out over time.
Okay.
You know, we right now feel like we're fully staffed, so that's the goal.
Great. And maybe we can tell, we don't need to get into the details of it now, but those 11 positions that are special fund allocated, would be interested in having a conversation with you about what their roles are, what they were filling, and then, you know, the impact of not having them and phasing them out will be on operations. I appreciate the work that you're doing. Just the inside work of your office and how you manage that with, especially this budget year, what you're receiving, what you're not, and how we're going to play into that for the future year. I appreciate the conversation after this. I wanted to give you an opportunity, and I know you brought this up during your analysis. You've been doing great work with Key Bridge recovery and support. I wanted to just give you an opportunity to kind of clarify, because there was some controversy that was associated with funds that were allocated or that were collected after the tragedy, and that we're doing what we said we were going to do, as well as helping folks that have been impacted by the bridge collapse. I just wanted to make sure that the $4.1 million that we're using related to the Key Bridge recovery is something that's our initiative that we're working on, and the work that you're doing is directly impacting and helping folks that were impacted by the tragedy.
Yeah, it's really a great question. Thank you, Councilman. So initially, the thought was that these would go to grants to businesses to help keep them afloat who are affected. Luckily, what we've seen is that the businesses are largely stable. It's really, the need has been around assisting dislocated workers, and that's what we've been doing. We've been using these funds and redirected them to support dislocated workers affected by the incident. And this approach ensures that our fiscal resources are allocated where they're most needed to help those directly in need. So I appreciate the question. We continue to do that work of supporting the dislocated workers related to the Key Bridge collapse.
Great. Yeah, appreciate the collaboration and look forward to working with you throughout the rest of the year. Thank you. Thank you, Mr.
Thank you. You too, Councilman.
Thanks, Councilman Young. Councilman Patoka.
Thank you, Mr. Chair. Mr. Stacks, I just wanted to acknowledge that you are one of the directors that is out and about in the community. I think that's really important. I see you at different places that I go that may not be directly related to your work program. An example of that is you're a board member of the Baltimore Jewish Council, and I see you at their events. I think that's really important that that you, as a leader of an agency, and I know it's really difficult for people in leadership positions like agency heads and council members to be out and about, because sometimes it feels like you're never off work. But I really applaud your efforts at being part of the community. You're visible, you're active, and it doesn't go unnoticed.
Thank you, sir.
Sure.
Thanks, Councilman Patoka. Mr. Stacks, I had a kind of super in the weeds question. When we fund the various cultural organizations everything from the symphony to the Baltimore Museum of Art. Does that money tend to be pass-through money, and in that, are we getting grants for that, or is it, where does that money derive from?
Yeah, a portion of that money comes from the state. And I believe a portion of that money is also ours as well. I have Jacob Knapp on the line. He's our chief of fiscal. He can tell you kind of all the details of the funding sources if you'd like. Or we could take it offline. It's up to you.
Yeah, I mean, I can send you specific questions, but there's some significant increases to some. I'm not saying they're new organizations, but things we didn't fund before, like, for instance, and again, we know this is a regional thing. No one's picking on it, but there's one line item for Fells Point Creative Alliance gets a $30,000 increase. Everyman Theater, which is also in the city, which is, a little less popular than Center Stage, let's say, is a $25,000 increase. There was a few of those that kind of caught my eye.
Yeah, I welcome the opportunity to discuss those with you. The allocations are really made through the Commission on Arts and Sciences with those grants. But I can discuss with you kind of their rationale and the advice of the board around, those specific organizations. So if you're up for that, it'd be my pleasure to do that.
Yeah, that'd be great. I had another question about, we were talking about the Key Bridge recovery efforts, and the welding training jobs. Is that being done through CCBC, or how are we? And I know Earlback is involved, which is a local welding supply contractor.
Yep, the welding program is done through CCBC. So we partner with them. Generally on the workforce side, we work very, very closely with our colleagues at CCBC, and they help us with a number of our programs. So the welding one specifically with the Key Bridge recovery is in partnership with CCBC.
And is there some rationale that anyone, well, not anyone, but some people that get trained to weld would be picked up by contractors doing bridge work? Or, I mean, I kind of feel like the bridge work is going to end up being a lot of out-of-town contractors that, and some are going to be union, which aren't necessarily going to take, just a person who's been trained as a welder and not a union member, not an iron worker.
Yeah, Mr. Chairman, the intention is to have them work on the bridge during the rebuild effort. That's the intent of the program.
Okay, but I mean, do we know down the road, will we have the ability to plug them in with union contractors? Because that's.
So there are a couple of discussions around that are in motion. So I don't have the answer right now, but as I continue those discussions, I'm happy to keep you updated on what we're finding out.
Okay. All right. Well, thank you, sir. We appreciate it. Were any other questions from the members? I don't see any other hands up. Okay. Well, thank you, Director Sachs. And we'll move on to Liz. What's up next? Health?
Mr. Chair.
Oh, yeah. Oh, I'm sorry, Councilman Jones.
That's all right. I just wanted to tell Director Sachs we certainly appreciate the job he's doing. We know how important it is to grow our economy. And, the stronger the economy is, the more we're able to weather the storms when they come. So we heard from the teachers union president last night, and we always know that there's never enough money to give everyone what they want or what they need. But we do know the stronger the economy is for Baltimore County, the better position we're in to be able to fulfill as many of those needs as we can. So thanks for your efforts. Keep up the good work. And we're here for you.
Thank you, Councilman. I really appreciate that.
Sure.
Thank you, sir. Liz,
Okay. Next, we have the Department of Health, and the analyst from our office is Reginald Sullivan.
great.
Good afternoon, everyone. Operating budget highlights for the Department of Health begin on page 2. The proposed fiscal year 2026 budget for the Health Department totals $142.3 million, an increase of $1.4 million or 1.0% over the fiscal year 2025 budget. The general fund portion of the budget totals $31.2 million and increases by $2.2 million or 7.6%, primarily due to salary enhancements, for example, COLAs, mid-year additions, and increments and longevities, which are partially offset by turnover savings. The special fund portion of the budget, the much larger portion of the budget, totals $111.1 million and decreases by $803,000 or 0.7% as a result of $14.4 million in grants received in fiscal year 2025 that are not anticipated in fiscal year 2026, offset by new grants for fiscal year 2026, which are $10.3 million, and an increase in continuing grants, which increased by $3.3 million. Other noteworthy highlights on pages 2 and 3 include a reduction in vacancies to 111 from 117 in March 2024, efforts and strategies to fill vacant positions, as well as relevant statistics for the Animal Services Division, and showing how opioid abatement funds were used. Capital budget highlights and ARPA are also mentioned on page 3. On page 4, Exhibit 1 displays the department's budget history. The pie charts show how the proposed funding will be allocated across funds and expenditures. Special fund continuing grants represents the largest program allocation, while personnel costs represents the largest category of expenditures. Continuing on page 5, Exhibit 3 shows the budgeted increases and decreases, with personnel cost changes in yellow, non-personnel cost changes in orange, and special funds in green. Exhibit 4 shows a history of authorized versus filled positions. On page 6, the analysis notes the areas within the budget that may reflect department-specific budget flexibility in an effort to provide insight into the operational context for any potential reductions. Finally, we have prepared a list of questions for the department and the Office of Budget and Finance, which we are hoping can be discussed today or addressed with a written response. I would like to thank the department and the Office of Budget and Finance for the assistance during this budget review process. And at this time, I would like to turn it over for discussion.
Great, thank you. I'll start. So good afternoon, Chairman Ertel and our valued council members. Thank you for your time today. I was honored to last be before you about 6 months ago when you confirmed my appointment as a Baltimore County Health Officer and Director of Health and Human Services. So I come before you today to proudly support our dedicated professionals here in the Baltimore County Department of Health and Human Services, and we work on the behalf of 840,000 Baltimore County residents. So during the past 6 months that I've been here, I've witnessed the true dedication and commitment of our staff at the department and the positive difference that's made in people's lives by their work. It's also very appropriate that we're before you this week, because this week is National Public Service Recognition Week, and it's an observance that acknowledges public servants at all levels of federal, state, and local government. So we're celebrating our team today and this week. I'd also like to take the time to introduce and thank the members of the Health Department leadership that are with me here today. We have Della Leister, our Deputy Health Officer, is here on screen, as is Lawrence Richardson, our Deputy Director of Finance Administration. And like others in our department, they are lifelong public servants, and their collective experience that they bring to work is critical for their success and to our department. So thank you for all you do, Della and Lawrence. And given that this is my first hearing, I also hold them in reserve for calling a friend to help answer any questions. So thank you both. So in December of last year, Baltimore County Department of Health celebrated 100 years of being in our community. So we had a celebration for that. And through that time, we've developed into what we are today. And the budget that we have today supports the work that we do in our core service agencies. Our core bureaus are animal services, behavioral health, clinical services, communicable diseases and environmental health, and community health. But this work is also strengthened by the collaboration and the support of our entire HHS team. That includes our Office of Quality Improvement, our Office of Population Health, our local management board, our finance and administration team, and our partners in the Department of Social Services. So our goal is to work seamlessly across all these bureaus and alongside with our community partners to continue and where possible to enhance our services that we provide throughout Baltimore County. So that brings us to today, and as you're aware, federal public health funding across the nation is facing uncertainty. While there's very much is still unknown regarding these funding impacts, should there be further funding cuts in FY26, the Health Department plans to continue to fund our current and core activities. And we plan to do this by managing our budget, allowing for natural attrition of our staff, maximizing our existing resources and partnerships, aggressively searching for additional grant funding opportunities wherever we may find it, and by continuing to focus on our core public health priorities. Delving into specific efforts, our Baltimore County's opioid prevention team, which is sometimes called the Opioid Response Task Force, is really an excellent example of how we're leveraging partnerships and resources, and we've been successful in reducing fatal and non-fatal opioid overdoses. Baltimore County has seen a 33% reduction in opioid overdose fatalities between 2023 and 2024, and a almost 50% reduction in overdoses since 2021. And we're able to measure our team's success by the implementation and evaluation of many of the initiatives that have been achieved by this opioid prevention team, including monitoring the number of fatal and non-fatal overdoses, the expansion of our public health vending machines that contain, among other things, naloxone and fentanyl test strips to reduce overdose or reverse overdose, calls to our REACH support line, which is our support line for individuals and families affected by substance use disorder, our response to 988 and 911 calls, our uptake of harm reduction services, widespread training for naloxone administration, as well as widespread distribution, facilitating access to medications for opioid use disorder, so long-term treatment, as well as our quick response team, which responds to overdoses, and by looking at metrics for that by the number of clients seen and the number of responses. So we credit this impressive drop in our fatal overdoses in Baltimore County to sort of the collective impact of these initiatives. Again, in our behavioral health capacity, our crisis response teams and our crisis response plays a really integral role in the Baltimore County community. We have a number of activities. We have a mobile crisis team, which is a partnership with police and clinicians to respond acutely. We also have a mobile response team, which is a partnership with our behavioral health teams. We have the 988 and a crisis hotline. We have a clinician embedded in the 911 center. We also provide critical incident stress management debriefs after trauma. We provide trauma-informed care training for frontline staff. And also we have recently participated in an analysis of the need and the capacity for a crisis stabilization center. So we're continuing to evaluate this initiative as key to our multi-pronged approach to address the county's behavioral crisis needs. Our Animal Service Bureau is another area where we've really been working diligently to enhance our efforts. Our initiative, Life is Better with Pets, is also using a multi-pronged approach to improve outcomes for animals in our county. And things that we are doing as part of our Life is Better with Pets initiative is really working to curtail the number of lost pets coming into the shelters. And that is by maintaining our community microchip scanning stations. We've also been successful in extending from 24 hours to 72 hours, the time that the public has to try to reunite pets found in the community with their owners before the mandatory turnover to animal services. We also provide support such as resources for low-cost vet care, vaccines, and pet food pantries to help owners retain ownership of their pets, to avoid them coming in to the shelters at all. And we continue to promote animal adoption very aggressively with our popular Cuddle Shuttle, which and hosting pop-up pet adoption events at various locations. We've also worked to expand our social media presence and actively utilized various platforms across that for outreach and for education. And we have a very robust volunteer workforce, and we work to recruit and also to retain and train those volunteers. So this is all contributing to our overall effort to address our consistently overcrowded shelter. This issue is prevalent not just in Baltimore County, but across the nation, these crowded shelters. So finally, one of our most recent areas of focus is concerning cannabis use and its effects in the community. So to better identify and understand the needs resulting from the legalization of cannabis, the Health Department received a small planning grant from the Maryland Department of Health. And this is separate from the Cannabis Reinvestment and Repair Fund. And this grant allowed us to conduct a community impact survey. This survey is still underway. It has not been finalized, so we don't have a final report for that yet, but we're going to use the results to really strategically address key findings regarding the impact of cannabis on our communities. So as you can see, now more than ever in 2025, we need your support for our proposed budget. Your positive support now will help us to be prepared for the tasks set before us as a department, and we're depending on the support in our ongoing efforts to have Baltimore County be where healthy people live, work, and play. And we thank you today for your time and attention. So thank you, and open to answer any questions.
Questions from the members? Anyone? Councilman Young.
Thank you, Mr. Chairman. Director Wilson, appreciate the presentation. Wanted to just ask, and it goes on the last presentation about vacancies. Even at the state level, the Department of Health is the department with the highest number of vacancies. You have positions that need high skill, high training, high education. And there are a number of factors that go into why we can't fill them. I guess I was trying to figure out from a standpoint of 111 open positions, how many long-term positions, like the focus on the ones that we have not been able to fill consistently over time, that consistently remain open. There was a reference to some of the strategies you're all using to recruit, and one of them had referenced enhancing the pipeline between the department and universities. Could you elaborate on what that means? And I only bring it up for previously working at Towson and knowing that Towson University and knowing that there are folks that are graduating and staying in the area, but not necessarily working in the field that they got a degree in. What is that that relationship or partnership that you referenced in trying to shore up that?
Yeah, no, that's a great question and something that we've really been working on. We do have specific positions that are hardest to fill, and those are social work positions, nursing positions, alcohol and drug counselors, environmental health workers, inspectors, and peer recovery specialists. So those are areas where we have a high need and also a lot of competition. Those are popular careers out there in the county and the city. But what we do have is our Office of Quality Improvement has developed a program where we're able to have MOUs with local universities and other training centers to have interns come in, work with our staff, and it's a way to help train in the community, but also hopefully to bring in our own new staff in that way. And that really does cut across those areas like nursing and social work and even peer recovery specialists. We have a specific program with CCBC for training of peer recovery specialists. So, and then we specifically work with Stevenson and Towson and Johns Hopkins, and others. So
Right.
that's something that we are working on every day.
Yeah, and when you mentioned the internships, I was curious about the opportunity to catch them as soon as possible to see what the work is versus what they think it is. And I guess the other thought was that I would say traditionally when folks choose to go into the public sector over the private sector or other areas that might pay more, it's because the incentives and the benefits are generally used to be better. Maybe things have, and I would say they've sort of evened out. So the incentive to go to the public sector, especially in the health division, takes away from the potential pool of folks. I know there have been conversations. There have been other things implemented around the county to try and incentivize that benefit again. Could you elaborate anything that you're doing to attract or even inform those students of, while you may not be getting paid as much as you would in another area, there is incentive to working for the county, to doing this work?
Sure. Yeah. So we do offer internships where students can really be within our department and experience the sort of positive impact of working in public health and working in government and for the public. We definitely emphasize the benefits of career development, of experience, of county benefits. And try to give those interns access to sort of the spectrum of career possibilities and where people can see the ladder to which they can go through. I believe our finance team has really made an effort to make that clear to lower level incoming that there is this possibility of moving through the system so that new recruits can understand what we do offer and how they can move through their career in the system. I don't know if Lawrence, you want to add anything to that description, but that's sort of my perspective on it.
No, I think you covered it well. And Councilman Young, to be specific, we utilize Handshake with the local universities, and that engages them both on the internship and for the non-clinical roles, as Dr. Wilson just mentioned, making them aware of work-life balance and some of those benefits of working in the public sector. So we do the outreach directly to the universities to have social work programs, MSW programs, and nursing programs. And then for the non-clinical roles we have, we're also reaching out to universities and engaging them also, like I said, through Handshake. We're also using Indeed. And then, of course, OHR, we're using LinkedIn. So multiple ways to reach out to the college workforce.
I appreciate your efforts. I know I share your interest from a top level of filling vacant positions, because I can only imagine the work we'd be able to do if all the positions were filled and meet the need of the folks that we're trying to provide those services to. Last thing, just please keep us informed as you go through the year. I know there's uncertainty associated with your special funds and grant funds. So as the state has already made commitments to trying to shore up some potential shortfalls that might come from a lack of federal funding, I've been helping to try and assist in shoring up those gaps when necessary, as they come, since the uncertainty that you mentioned earlier, you're not sure how it's going to affect you over the next fiscal year. So please keep us informed, and I appreciate the work you do. Thank you.
Thank you, and we will keep you informed. Other questions? Yes.
Councilman Jones.
Yes, Dr. Wilson, I just wanted to share with you something that I'm sure you know. You guys are very important to our community. You're our first line of defense, and I will not forget what the health department did during COVID and how you guys were shining stars. And I know how things work as we get further and further away from situations like a global pandemic like COVID. I know how things can be lax, but I would just urge you to continue to be vigilant and don't ever hesitate to reach out to us in terms of how we may be able to help maintain that level of vigilance so that when the next pandemic comes, we'll be fully prepared. Thank you.
Thank you so much for saying that. And you're right, you know, there's the acute response to a pandemic or an emergency, and then there's all the time in between and after. And we try to take the lessons that we learned from that big response and continue that as we prepare for the inevitable next issue. I mean, currently we are performing tabletops and education for measles awareness because of the measles outbreak in the US, as well as preparing for potential bird flu with that H5N1. So we try to take what we learned and move it forward as we prepare, and it's a big job. So thank you for acknowledging that.
Sure. And one more question. I heard you mention it before. The Narcan vending machine. Have people been generally using those machines?
Yes, they really have. So we have a team that has to keep them filled. And so there are at a number of locations, we have larger machines and smaller machines. We have a machine at our Eastern Family Resource Center, at Corrections. We have one in the lobby here at Drumcastle. And then we've got smaller machines out in a lot of our satellite clinics. You know, we have, I hope I get this right, 7 satellite clinics and we've also got a vending machine at the Animal Services. And so all of those are popular. We also try to have other public health available, or we intend to have other public health resources there as well, such as condoms, or we even have some gun safety locks provided by the Veterans Administration. So we want to expand that further to sort of reduce those barriers for people to get easy access to those really important, potentially life-saving tools.
Do we have any positive outcomes that we can point to these kits being distributed?
Can you repeat that? Do we have any positive outcomes regarding?
Yes. Do we have any positive outcomes that we can point to where somebody saved someone and they said, hey, I got this kit from the vending machine down the street?
Oh, that's a great question. I'm going to turn to Della to see if we have any specific examples of that. I mean, we know that we have this greatly reduced overdose rate in our county, and we're seeing that in other counties and in the US as well. And that is largely credited to that widespread distribution of Narcan. But do we have, nice anecdotes to support that? I wish we did. Did we, Della?
Whether or not the fire department can share information with us, like, hey, the person was revived because, I don't know. I know we've done a lot of things in terms of a society, in terms of holding individuals sort of harmless when they call for help when somebody's overdose and not seek to arrest them for possession. So I know we've done a lot of things. I'm just curious if we have any stories that we can point to.
Councilman Jones, I don't know if we have stories. We have numbers of utilization from those vending machines. The other part that we do have is a great relationship with EMS. We have a leave behind program. So I think if we searched, we could find some stories of like, where did you get in the naloxone? Did you get it from a training? Did you get it from a vending machine, or did you get it from a leave behind? But that's probably like after the fact from the immediate response, but we can look at that going forward. But we do have data related to utilization, but I don't know if we have the human interest story, which is I think what you're looking for.
Maybe we can ask some of our peers to keep their ears out for that that kind of information, because I do think it tells a really compelling story to support these efforts.
Yep.
If we can do that.
All right, thank you.
Thank you.
Thank you, Councilman Jones. On that subject about opioid deaths, question. So it looks like we've reduced deaths by about 33%. Do we know what that death number was last year? What are we down to?
You mean the number of deaths last
What's
year?
what's the actual
Tally. We definitely know that. Do I have it memorized? No, but I can see Della's looking to get you that information. Thank you.
And I guess the other question is, are we seeing some of the decline, because I think doctors are pretty much limited in how many opioids they can prescribe now after that, some of those reforms. And I guess the question is, are we seeming to get new people that are addicted to opioids somehow?
So it's really very multifactorial, but you're right. There is this program called the Prescription Drug Monitoring Program where physicians are monitored for their prescribing, and patients are monitored to determine whether there's an issue going on. And I think that has helped. There's been a lot of education about prescribing practices. One of the issues that really contributed to overdoses is the rise of fentanyl. And so fentanyl itself is not just associated with other opioids, like with heroin. It also contaminates many other drugs as well, like, for example, cocaine. So that was a big contributor, and we've noticed that those fentanyl-related deaths have started to come down, whether it's in combination with other opioids or in combination with off-market pills or with cocaine, et cetera. So why is that? Why is there a decrease in fentanyl? There's an increase in awareness of the risk. There's an increase in naloxone to reverse those effects. There are increased efforts to control the amount of fentanyl coming in. So again, I think it's very multifactorial. I don't think we can point to one thing. There's a lot more education out there. It's talked about a lot more. It's out in the open, and there's a lot of community support and community programs out there for families and people affected, which are very effective, using peers, people with lived experience and all of that. So just all of that combined, I think, has sort of come together to really help.
Okay, great. Councilman Marks had a question, and then I think Councilman Jones again. Councilman Marks.
Thank you very much. You've all covered, I think, what I was going to talk about, the decrease in overdose deaths. I just wanted to bring up the great work done by the Daniel C. Torsh Foundation, based in my district, and other groups. I just had a very quick question, and Director Wilson, I don't know if you're the right person. I know we have this Animal Services Advisory Committee that had worked for many years. Apparently, it has been largely inactive for the past 1 or 2 years, and I would just urge the administration to do what it can to work with us to make sure that's revitalized, because these animal issues, and we've made a lot of progress on animal issues, but they have bipartisan support. You have Democrats and Republicans alike who care about these issues, and that committee has kind of gone, it's kind of drifted. So just putting in my 2 cents there.
Thank you. That's important, and we also support that.
Right.
Councilman Jones, did you have a question?
Yes, I was going to make a statement. We were talking about, it's a good thing that deaths are going down, but the reality is most people die of overdose because of fentanyl. They don't know they don't suspect that that's what they're taking. They think they're taking some other drug, and someone has laced it with fentanyl. And so I guess figure I'd make that statement out there for anybody who's listening. The reality is The people that are dying from fentanyl don't know they're getting it. They're not asking for it. They're getting it, it's laced with something, they're lacing something else.
Yeah, and you're right. One of the things that we try to distribute as part of our harm reduction services and also in our vending machines and educate people on is that exact issue. So one of the things that we do make available are fentanyl test strips, and those are little test, like those little tiny strips that you would put in, and that can detect whether there's fentanyl contaminating the medication or the substance. And so again, what percent of people have those, use them? Many more could, but we're trying to just have that be part of our harm reduction package. There's another contaminant called xylazine. We also have xylazine test strips as well. So that's a great point. And yes, there's a lot of accidental ingestion of fentanyl when people think they're getting one substance and it's more than one substance.
Councilman Marks, did you have another question? No, okay. All right. I think you guys have covered it, and we appreciate you being here. Liz, next up.
Thank you.
Thank you, Dr. Wilson and staff.
Okay, next up, we have the Department of Housing and Community Development, and the analyst from our office is Chris Sheffield. Take it away, Chris.
Thanks, Liz. Good afternoon, everyone. The operating budget highlights for the Department of Housing and Community Development begin on page 2. The proposed fiscal year 2026 operating budget for the Department of Housing and Community Development totals $17.4 million, a decrease of $284,000 or 1.6% from the fiscal year 2025 budget, excluding the federal allocation to the Housing Office. The general fund portion of the budget totals $2 million and increases $622,000 or 45.2%, primarily due to transfers of 8 positions from the special fund due to the sunsetting of federal grant funding. The special fund portion of the budget, which reflects the activity of the Housing Opportunities Fund, totals $15.4 million and decreases by $905,000, or 5.6%, primarily due to an expectation of reduced funding for several grant programs, including the Homeless Solutions Program. Other noteworthy highlights on pages 2 and 3 include the county's progress towards meeting the requirements under the Voluntary Compliance Agreement, currently progressing Housing Opportunities Fund projects, an increase of vacancies to 8 from 4, and a status update on the department's initiatives during fiscal year 2025 and planned for fiscal year 2026. Capital budget, Housing Office, and ARPA highlights are also mentioned on page 3. Then on page 4, Exhibit 1 displays the department's budget history. The pie charts show how the proposed funding will be allocated across funds and expenditures. Grant expenditures represent the largest category of expenditure, followed by personnel expenditures. Continuing on page 5, Exhibit 3 shows the budgeted increases and decreases with personnel costs changes in yellow, non-personnel cost changes in green, and special fund cost changes in blue. Exhibit 4 shows a history of authorized versus filled positions. On page 6, Exhibit 5 provides a historical visual of the county's progress towards meeting its 1,000 hard unit requirement under the VCA by 2027. Exhibit 6 reflects the Housing Opportunities Fund balance. Then, page 7 notes the areas within the budget that may reflect department-specific budget flexibility in an effort to provide insight into the operational context for any potential reductions. Finally, we've prepared a list of questions for the department and the Office of Budget and Finance, which we're hoping can be discussed today or addressed with a written response. I'd like to thank the department and the Office of Budget and Finance for their assistance during this budget review process. And at this time, I'd like to turn it over for discussion.
Thanks, Chris. Mr. Chairman, with your permission, I'll jump in first, or?
Yes, Director Hickey, go ahead.
Excellent. All right. Well, again, thanks, Chris, for all your help leading up to this. Good afternoon, Chairman Ertel, members of the council. I'm excited to be with you today to discuss DHCD's proposed FY26 budget. Time's gone quickly. I've had the honor of leading this agency since the council established it just 4 short years ago. And when we get to the end of the year now that I'm going to call productive but uniquely challenged yet again, I'm excited to highlight a few key accomplishments and then address your questions. I did want to point out, and Chris had mentioned this, before I dig in, I want to acknowledge that DHCD's proposed FY26 general fund operating expenditures are increasing as we move some core staff into the general fund. That said, DHCD's total general fund expenses are still just under 2 million, which, if you put it in proportion, is less than 2% of the agency's 132 million overall budget, if you look at all of our pieces and parts. That means we are still one of the smallest agencies in county government when it comes to general fund operating costs. Now, as you know, our core work is underwritten by leveraging state and federal dollars to provide direct assistance to constituents and also a financial investment in nonprofits and other partners. What we're moving into the general fund represent core DHCD functions going back to the beginning of our creation that include things like our data analyst, staff who monitor grants and ensure that we're compliant with federal and state and local rules, and also constituent services and community engagement. A great example is, I think, just about every council member on the call has worked with Essence Cropper, our community engagement outreach specialists. So these are the type of positions that we created and are migrating them over this year. Despite DHCD's relatively small general funded footprint, we do have some big outcomes to discuss as we move into this next year. You know, the VCA is a big priority. It sunsets in 2028. A real focus for our team has been to build the capacity to go after large-scale VCA eligible deals so we can catch up on goals and ensure we're on pace to be done. We've approached the challenge by really working with developers, financial institutions, communities, and I think key, almost everyone on the council. I don't think there's a deal in the pipeline that the appropriate council members don't know about and that we've been working consistently to get these things done. We've had to build out our capacity to negotiate complex deals with multiple funding sources, and you know, the environment for getting anything developed these days is getting harder by the day. Last year was highlighted by the largest attainable housing deal in the county's history with MCB. I will say that was awarded an innovation award from the Community Development Network. That's a new one for the county. So we have an award-winning development. And I do want to thank Councilman Ertel specifically for really showing how we can work together to do big scale deals when you look at the highlight this year so far, which is Loch Raven Overlook. It's a new construction project, just closed on the hotel last week, Mr. Chairman. So moving forward on that, this development is going to transform a troubled hotel near a busy intersection into a thriving community and also hopefully an anchor for a community that's craving investment and revitalization. It's really great that I get to come after Jonathan and Dr. Wilson because it points out housing sort of sits in the middle between health and economic wellness and how we all work together on these deals. Just to remind folks, Loch Raven Overlook is going to provide 115 VCA units, community space that includes 6 accessible apartments. We're really struggling for places for our disabled residents to find units. While the VCA is critical, I want to remind everyone that we also focus on preservation and improving existing housing. Councilman Young, we've talked about this. I want to point out, I think one of the quietest, best stories is the work we've been doing over at Lakeside Homes at Holiday Heights, formerly known as Circle Terrace. We talk a lot about the development of new housing, but we have a 300-unit apartment complex that has been failing for decades, long before any of us in my shop were on. We've been working with Nuveen, the new majority partner, on the complex. They've already invested millions of dollars. They're on their way to finalizing their rental registration license. They have a wait list of already hundreds of people looking to move in. A place people couldn't wait to get out of is going to be a thriving community at the center of a lot of other development, including a new high school. Councilman Marks, you and I have talked about this a number of times. Investment in these old failing communities, better strategies for moving forward, balancing preservation and livability with new construction is something that we really hold important and want to keep doing. We've also worked through our housing finance team to negotiate pilots and other investments using different funding sources to preserve existing affordable housing at places like Weinberg House, Hopkins Village, Essex Co-op, key senior deals. You know that we can't count senior housing under the VCA, but we would be negligent to not continue to find safe, healthy, affordable places for our seniors to live and for our seniors to remain. But we're more than just investment in housing production. The Office of Housing alone, under the leadership of our new executive director, Kenyatta Green, who we recruited in a national search, assisted more than 5,800 families in this prior year. That includes more than 439 new families who we were able to pull from the wait list to replace those who'd left the program. As you know, many of those had waited a considerable amount of time. We've also enrolled 23 additional families in our self-sufficiency program that is designed to assist families with economic independence, self-sufficiency, and ultimately home ownership. And as I often say, my staff knows, sometimes the best housing we've got is the housing people already have. Housing stability is a big deal for us. I know you know that we ran one of the most successful national eviction prevention programs during COVID. You do know that that money is beginning to run out. We've tried and worked really hard with our team to stretch it as far as possible. We've converted some of those dollars into counseling and housing stability services to help tenants negotiate with their landlords, find ways to stay in the property, come up with payment plans, and in some cases, we still are doing direct rental assistance. Over the last 2 years, we've helped just over 1,200 households with this type of counseling help. And since May of 24, we've been able to avert another 100 evictions using the last remaining gasps of federal eviction prevention money that we have. We're actively working with the county, with the state, and to the degree we can with the federal government to find new supportive funding. And we're really excited to say that one of our best providers, Cornerstone Franciscan Ministries, with our assistance, has applied to obtain community schools rental assistance program money that was put into law in large part by the leadership of our own Senator Hettleman. I know many of you on the council are very connected to the community schools in your districts. This would allow the county to provide rental assistance to families identified through their community school coordinators as being in danger of losing their housing. I know you also know and interact with a number of nonprofits that receive funding from DHCD. In fact, we are one of the largest direct funders, not just in county government, but in the county. Our FY25 public service grants, a mix of federal and county funds, went to 14 local nonprofits. We supported everything from abused and neglected children, adults recovering from sexual abuse, mental health counseling, adult medical daycare, and the list goes on. In total, the groups that we funded have been able to serve over 2,000 individuals from 1,800 households in the last year. Last year, at the direction of the county executive, we also dug deep on housing stability, working with other partners in county government. We provided targeted grants to groups that ended up serving over 61,000 individuals from almost 30,000 households. These groups are primarily funded with the limited amount of general fund grant funds that we have and a small supplement from federal funding. This included food banks, client choice pantries, and after-school summer meal programs. We've also used our funding to do capital projects. We've stabilized and modernized critical facilities, frontline health and psychiatric care, providing assistance to folks in communities like Dundalk, Pikesville, and Rosedale. We've improved access to primary care and a range of clinical services by helping with capital needs at the Baltimore Medical System facility in Rosedale. We also helped to rehabilitate facilities delivering mental health counseling in Pikesville through Prologue and Dundalk through the nonprofit Key Point Health. These investments help to deliver clinical services to approximately 7,500 clients annually. I do just want to say briefly, tens of millions of dollars flow through DHCD. If you look at the pandemic alone, we're talking $120+ million that flowed through us to the county. There's a reason that we've done well in audit findings. There's a reason that our work has been clean and supported by the federal government. We have continued to advance our role in technical assistance, providing direct oversight of our grantees. If you remember, during the pandemic, we received an additional $1 million from the Treasury because we were good stewards of the funding. We hired a new deputy director this year, Sylvia Bolivar, who spent a good deal of time with HUD, extensive grants knowledge, and we will continue to be one of the leaders in the state in the way that we steward public dollars for public use. Quickly want to talk about, I know Councilman Jones and others pay close attention to work with homeowners. Again, our housing finance team has leveraged home CDBG funding for homeowner rehabilitation, deferred maintenance, and accessibility that allow our seniors to age in place. To date this year, $1 million has been used to assist Baltimore County homeowners through housing counseling and down payment assistance, and approximately $800,000 have allowed us to help remediate lead from 73 households, including some down in Turner Station. And last but not least, I think our homeless services team interacts with just about all of you on a regular basis. And I think you recognize the amount of collaborative work that has been done across county government. The numbers, though, I'm going to end on are pretty staggering. We have served across all of our homeless services projects this past year over 3,500 individuals. We have worked collectively as a system to house almost 600 people permanently. We have diverted 24 from shelter and exited 8 recently into positive housing from shelter. We've invested in our coordinated entry system. We've invested in our HMIS system. And these advances have allowed us to pull down several $100,000 in additional federal money for this upcoming year for homeless services. So we are doing our best to leverage the funds to make the biggest difference for the people who need it the most. I really want to thank you for your partnership and support this past year. It's an honor and a privilege to lead this department, and I'm happy to answer any questions you may have. Thank you.
Councilman Jones.
Thank you, Mr. Chairman. I just wanted to tell you, Terry, that I appreciate your responsiveness. You, as well as your staff, have been very responsive to me, and you're right. Whenever we've had issues, you guys jump right on it and took care of it, and I really appreciate it. And thank you for providing a hell of a service to the city. And of course, we're excited about all the money that goes to our first-time home buyers and others to help them get permanent housing. So, thank you very much.
Thank you, sir.
Thank you, Councilman Jones. Councilman Patoka.
Thank you, Mr. Chair. Mr. Hickey, you indicated you have a new deputy director.
Yes, sir.
Did the previous deputy director leave, or is it a new position?
So last December, our first ever deputy director left to take a position in Prince George's County.
Who was that?
Ashley Johnson Hare.
Okay. So how long was she with you? Just curious.
Sorry, sir, you're echoing a little bit.
How long was she with you?
She was with us about a year.
Okay. And so she left December. And it's okay.
I believe so, yes.
Okay, just curious if it was a new position or if it was filling vacancies. Sounds like it's filling vacancies.
Yeah.
Okay, thanks.
Thank you. Oh, thank you, by the way, Councilman Patoka. I just wanted to thank you publicly for stopping by our annual meeting, listening to some of the panels going on. Appreciate you being there.
Yeah, it was very interesting. Thanks.
Councilman Young.
Thank you, Mr. Chairman. Director Hickey, you mentioned in your comments, I was actually just going to thank you for the work you all done related to Lakeside Homes. You said it as well. It's been a problem area on this side of town for decades, but in a short period of time, in no short order, because of the work that you all do and the fact that your office exists at all, have been able to work with the federal, our federal partners, work with the new agency that's handling the area, to come to a resolution that, like you said, I'm excited about the result. I know like you said, it's been quiet on purpose because things needed to fall into place, and a crash course in federal housing policy for anybody that's been trying to engage with these folks. But had you not been here, there would have been no way to weed through the bureaucracy, but also engage with the property owner and the new property manager to try and get into a better position. So I appreciate the work you did on that, and look forward to, at some point, letting everyone know once the final decisions have been made, what we're expecting to see there in the next few months to few years. The only other thing I had in terms of a question was, we are closer than we've ever been to meeting the compliance with VCA. Again, because of the work that you all have done, I think you know this and your staff knows this and other folks know that that's not an ending point. It's a starting point. And I guess I'm curious, moving beyond that, what you see, well, the primary goal is to reach the what we've indicated is the need from the feds, but what do you see after we meet that goal? What do you see the next step is, and how do we keep moving so that we don't fall into the position that forced us to go into a compliance agreement in the first place?
I appreciate that. And I think, you know, I'm not trying to be cute when I say it's the relationship with the council and all of you and through you to your constituents. I think I have been really pleasantly surprised and heartened by how, when we all dig in, we can get these deals done. I think we need to do a couple of things. We're wrapping up initial work on data collection around the actual need for housing. We have to be really careful because, as I've discussed with all of you, the VCA was not a needs assessment. It was a legal document. For instance, do we really need to continue to try to force 3-bedroom units? Are families changing? What do we need for the people? We definitely need more accessible housing, affordable, accessible for people experiencing disabilities. We need to dig in locally with each of you, tying housing to redevelopment, revitalization. I don't think Councilman Koch is on. Oh, there he is. We had a really good conversation the other day about finally getting upstream, not being reactionary with housing, looking at infrastructure needs in a community, looking at growth patterns, determining up front where are the right and good places to do housing, and going all in to invest in that, and not spend our time fighting over, you know, half-finished proposals. So I think leading with data, leading with the actual need people have, working with each of you, sharing that information, coming up with individualized plans, and tying them to infrastructure improvements and growth are really going to be the secret to getting this done. And to keep, you know, let's not let housing be an emergency. Let's let it be one other part of how we grow and thrive.
Agree with you completely. And you being here and your staff also make sure that it stays part of the conversation. Up until before you being here, the question of whether this is well, I believe, and I think other folks would agree too, that this is a role the government should be playing. It seemed to take a sidestep to, it's just another thing that other previous administrations, other previous councils sort of allowed for maybe the market, maybe individual actors to determine for themselves what's best for the county. You being here puts it to the forefront and makes sure that we don't make it an afterthought and we're being proactive rather than reactive to these situations. So thank you for the work that you do. Appreciate it.
Thank you. That means a lot to my team, by the way. This is really hard work and sometimes it's frustrating. So hearing that means a lot to them.
Thank you, Mr. Chairman.
Director Hickey, I had a question. The Lock Raven Overlook project, is that part of the 908 VCA goal number?
It is. Yep. It's on the approved list now because the funding went through council.
Okay, so we have 908 approved. Where are we? Do we have others in the hopper where we're close to getting to the 1,000?
We have, that's a really great and a difficult question all at the same time. I've talked to you about some options that we're working on. I think I've talked to every council member about the options we have in our pipeline. If we can stay ahead of all of the volatility that's going on, that all seems to impact housing production, we have enough in there to get us to the end of the course. So that's why we're working so diligently to make sure that the financing goes through, the legal work is done. Hopefully nothing goes wrong at the sites. And we're going to continue to look for additional deals to pad our numbers. We need the housing anyway, right? And so making sure that we're not leaving this to chance. Where we need to continue to look at our ways to do housing for those who need accessible features that is not always new construction. We struggle a bit with trying to do scattered site, single family home accessible work. And we're looking into some options for figuring that out because there really is a growing need for accessible housing in the county.
Yeah. And, Councilman Young was talking about, where do we go from here once we get to our goal? I'm sure you see it, but it seems to me that unfortunately the VCA has taken our focus away, or our ability to maybe deal with it as efficiently as we could. It just seems to me that a lot of the senior housing is where we're really in crisis now, where we're literally pushing people who've lived in the county all their lives out of the county while we're bringing in people that aren't from here to house them in, you know, family units, while we're telling people that have spent a lifetime here, sorry, your apartment's $2,200 now and your social security check is $1,800. You know, figure it out. Work at Walmart, you know, be a greeter. It's just heartbreaking when you hear from, you know, 82-year-old seniors who don't know what they're going to do. And we take I mean, I don't know about my colleagues, but I get about 2 of those calls a month. And, you know, there's no good answers right now anyway. And, you know, the other thing that I'm struggling with across my district, but specifically in Towson, it just seems like we do not have, and I'm not saying it's us per se, and I know it's a complex issue, but the homeless problem continues to be an issue. I had several homeless people living at the library in the alcoves there. We're finding needles on the ground everywhere. Kids are walking by. It's just a lot of the business people have given up in Towson with, you know, the police can't do anything about it. There's no, everybody's pointing the finger at each other. I don't see Prologue out there engaging these people as I don't know, that I was going to say aggressively. I don't mean that, but I just don't feel like they're being as proactive as they could be with some of the people that we have. And it just seems like a lot of the homeless that we're seeing now, there's a lot of like severe mental illness associated with it as well. It's not just, I'm sure it always had to do with mental illness, but we're seeing people acting out. We had a particularly horrific stabbing back in the fall where a girl was stabbed, 18-year-old girl was stabbed in front of Raising Cane's by a homeless person who actually filmed it on their phone. And I continue, I worry about this situation because, again, there's no good answers and the public is getting, is losing patience with us.
Well, we have a lot to work on. And listen, I just want to say, number one, I appreciate your ongoing advocacy around the issues you're saying now. I think everybody needs to know these are the conversations we have, not just the hearings, but all the time. And you're getting behind this and communicating. I know Heather and the team are listening, and it doesn't get a lot of attention. We talk about housing, we see homelessness on the streets. Over the last 3 years, and I think as council members, you'll appreciate this, the degree of effort that has gone into linking health officials, mental health officials, our ACT teams, the police, fire, working as one, oaring in the same direction. I didn't put it in my comments, but we have worked closely with 22 encampments just in the last several months, like intensively. And 9 were closed because we were able to work on housing solutions. They were both getting unsafe and we had opportunities. And it is just the grind and the collaboration and the data. And then people see folks in a certain place and go, well, that's not working. And it's just such a long grind of everybody working together, but our foundation is so much stronger. So let's look to better times, I hope.
Yeah, I mean, like I said, it wasn't a disparagement. It's just, it's becoming, unfortunately, in the Towson area, when I go to meetings, it's like a top 3 issue now. So, Councilman Marks.
Thank you. And Councilman Ertel, Mr. Hickey, you both mentioned Lock Raven Overlook. The revitalization of that intersection was something we tried to start off, and it's nice to see that good things are moving in that direction. I do want to thank your office and Prologue for their help with an encampment in the Kearney area, Joppa and Harford Road. Again, very difficult situation, and you were very helpful there. Terry, you know, I'm probably going to bring this up, Belmont Dunfield, right? Neighborhoods like this that were built in the early 1970s, really substandard construction that are the materials just seem to be falling apart with a road network that is privately owned. I hope the county really takes a second look anytime we are asked to have private roads, because in my opinion, in many cases, these become a recipe for disaster. Homeowners associations become defunct. The roads are never maintained. It just is a spiraling problem. So do you have any more thoughts on Belmont Dunfield?
So I'm happy to meet with you offline as well. We've actually
Right.
been having some significant conversations. I think you probably know, due to our efforts with the management company there, we've pushed them. They've redone a lot of the balconies. We've revisited this idea of community space. They've changed up investor partners. One of the things that we're also focused on, obviously, communities being more livable, but a lot of these ownership groups, we need to be careful of their investors, what they're looking to do. We're working closely with the state to find funding for some of these large communities to help them continue to reinvest. What we don't want what you described. We also don't want people walking away from these properties and leaving them, or turning into something worse, or losing the units. So I can give you some more updates on Dunfield and some of the meetings we've had, but in general, we're paying a really close attention. And I think you all know what a number of these bigger communities are. So thanks for your advocacy on that.
So it is something you're looking at, right?
Yes. Yes, sir.
Okay, because you know the county executive's interest there, and
oh yeah,
it's just been a forgotten area over many years, and appreciate you looking into this.
Yes, sir.
Thank you.
Thank you. Anyone else? Okay, I think I think that's all for today for the budget hearings, and we have another set of hearings on Thursday at, I think, at 2 o'clock. So we see everyone then. I'm sure Chris will get the link out to, if you don't already have it. I know she had to do a new link right before this meeting. I think some people had trouble getting in. Liz, did you have anything
Nope,
for the
that's
good
it.
of the order?
Back to work. Got to get back to work.
Back to work. All right,
Thank you all.
thank you for being here. Appreciate everyone's time.
Have a great day.